Hey, I'm Christian. Um, this is Ginger. I'm going to do my physical assessment on Ginger and for parts of it, this teddy bear. Um, so to start, this is Ginger. She would probably tell you she's about 10 years old. She looks alert. She's oriented to most likely, where we're at right now. She looks well nourished, good hygiene, uh, no physical deformities looking at her. She's got good posture, appropriate facial expressions when she looks at you, and her speech is fine when she barks. Everything sounds okay, normal. From there, moving on to skin. So her fur, I guess, would be like white fur. Everything looks fine. I guess she's a little shy, but fur looks okay. No abnormalities, nothing wrong there. Um, then I'd be moving to the head. I would first inspect. Looks okay, normal size and shape, nothing noticeably wrong. Then I would palpate, so I would feel the head for any lumps or bumps. I would inspect her cranial nerves. I would have her, if she could, clench her teeth and stick out her tongue. I would then palpate her maxillary and frontal sinuses, so I'll do it on here, palpate the sinuses. Then moving to her eyes, so I look at her eyes, I can get a look at her eyelids, eyelashes, eyebrows. Also, nothing noticeable there, no redness, no anything. Then I would look at her sclera, her pupils, her iris, and her conjunctiva. No redness, no problems there. Everything looks okay. Then I could do a Perla assessment, so pupils equal, round, reactive to light, and accommodate. So I'd use a light. I'll try not to shine it too much in her face, but this is also the corneal light reflex. So she actually has her left pupil stays constricted, does not dilate. We've noticed that for a while, and I can't imagine she sees too well out of that. But that's something noticeable in the left eye, so slight abnormality. From eyes, I could also do the EOM, the 6 cardinal signs of gaze. So I would have her look diagonally and left and right to check all of her the muscles in her eyes. I would also do like a near vision check. So I would have her maybe look at a card close up, maybe close one eye, and try to see how close her vision is, or how good her vision is up close. From eyes, I could move to ears. So I would inspect, palpate. Nothing noticeable. Everything feels fine. Not too much wax or anything. I would test her hearing, so I could snap on one side maybe and snap on the other, see if she hears on each side. Then I would move to her nose, so I would inspect, palpate. Nothing noticeable there. I would also check patency, so I would plug each nostril, make sure everything's going okay on each side for patency. I would then move to her mouth and throat, so I'm going to give her a small snack, and I would inspect her lips, her gums, her tongue, teeth, palate, mucous membranes, and I could maybe grade the tonsils and take a look at the uvula. So I'll do that and hopefully inspect almost everything there. So take a bite of this. And so her teeth, so hopefully she eats that. So her teeth could probably use a little bit of cleaning, but otherwise everything is okay. Moving on there, I would inspect the neck. Everything looks okay. I would do a range of motion of the neck, so if she could, I'd have her turn each way, back and forth, everything, make sure it's okay. I would check the strength of her neck and shoulders, so I would put on a person, put my hands on someone's shoulders and push down, have them shrug up, stuff like that. I would also palpate the lymph nodes, palpate her trachea. I'll let her eat that. Palpate her trachea and her carotid pulses one at a time. So I'll let her finish that first. But so for the lymph nodes, I guess I could do it here. I would do the preauricular, postauricular, occipital, posterior and anterior cervical chain, the tonsillar, the submandibular, and the supraclavicular down here. Okay, so she ate that. So then I could inspect her neck, maybe feel for her carotid, assess her trachea. Everything feels okay. Moving on to the posterior chest. So just looking at it, no noticeable deformities. Palpate for expansion. Everything sounds fine, or it looks fine. I would do tactile hermesis. So I would, if she was a person, I would put my hand here and have her say the number 99 on, in different areas and feel for that. I would percuss the lung sounds, on each in the lung fields. Then I would percuss the CVA, so over her lower back, where I imagine her kidneys would be, percussed there. If she could tell me any pain or tenderness, anything like that. Then I would auscultate the lung sounds, so I'll do that with my stethoscope and, assess that. From what I can hear, clear. That's how our lungs sound. Then I would go to her heart, so I would inspect her chest, look for any abnormalities there, nothing noticeable. I would palpate for a PMI. I would also palpate for thrills or heaves, and then I would auscultate. So on the right sternal border, second intercostal space would be the aortic, and then second intercostal space, left sternal border would be the pulmonic. Third intercostal space would be the herbs. Fourth, tricuspid, and then fifth, mid-axillary would be the PMI, the mitral. So I palpate there on her, and then auscultate all those different areas. So do that. Definitely an irregular rhythm. I think we take her to the vet and they're aware of that. But so that was auscultation of the lung sounds. Next, I'll move to her upper extremities. So I'll take a look at her hands, arms, and shoulders. I would assess her capillary refill and her nails. I would do check her radial pulses. I also do a range of motion of her shoulders. All different types of stuff. If she were a person, I could have her, lift her hands above her head, out to the side, stuff like that. I would then move to the abdomen. So I would first inspect the abdomen. Then I could auscultate for, auscultate the aorta for any bruit. From there, I could auscultate each bowel sound. I'm not going to flip her over and make her uncomfortable, but I would listen to each quadrant, left upper, left lower, right upper, for bowel sounds. I imagine they're active. She just ate, and everything's okay there. Then I would percuss and palpate first, first lightly, then more firm. Ask her for any pain, anything like that. Make sure things are feeling okay. Maybe if she's passing gas or anything along those lines. Next, I move to the lower extremity, so I would look at her legs or feet and legs, make sure everything looks normal there, no abnormalities. She's walking around, should be fine. So I'd palpate the posterior tibialis and the dorsalis pedis pulse. I don't know how well I could assess that on her. I'd also assess the range of motion. So I would, if I could, lay her on her back. I would have her elevate, maybe bend or flex her knee, do an abduction and adduction on each leg. Make sure everything's okay there. From there, I'd move to a more neuro. I would do a superficial touch, so if she could close her eyes, I could touch her all over, hands, feet, legs, arms, back, everything, and with maybe a cotton ball. And she could tell me where that was. That's how I'd assess that. I'd have her pronate and supinate. I would also have her put her heel to her opposite shin, go up and down on each side, and that would assess movement and all the extremities. I would also do like a deep tendon reflex. So I would use my stethoscope and assess a brachial, assess the the screen's getting dark here. Assess the brachial, so in the arm, I could tap that. Assess for brachial. I could do a plantar on the knee. I would also do an Achilles and a plantar reflex by doing like a backwards J on the bottom of their foot. You can assess that reflex. Moving on, lastly to musculoskeletal, so I would have her just walk. I mean, you can kind of see she can move well here. I would have her do a tandem walk, so that's one foot in front of the other. This would be more for a person who can follow the commands. Do a Romberg test, have her close her eyes, assess her balance. Also have her do a range of motion of her spine, so can you bend forward, lean back, twist side to side. And so yeah, that would be it. So I just want to thank Ginger. She was very patient and helped me a lot here.